Ovarian cancer has become a major concern due to its increasing rate today. This cancer begins in the ovaries, the female reproductive organs which produce eggs. Even though it's a rising concern, it usually goes undetected as its early symptoms are subtle and easy to overlook. Today, we will learn 10 signs of ovarian cancer that 90% of women ignore. Number 1. Persistent abdominal pain. We all usually ignore abdominal pain, assuming it might be due to something we ate. But do you know that persistent abdominal pain is one of the most deceptive signs of ovarian cancer? At first, it feels like typical discomfort. Later, this pain becomes part of your daily life, making you feel like you're carrying a heavy weight inside your belly. It worsens over time, interfering with your ability to enjoy meals, exercise, or even relax. It's more like a nagging, continuous pain that doesn't seem to let up. This is because a growing tumor exerts pressure on surrounding organs and tissues, causing ongoing discomfort. As the cancerous cells grow, they form a tumor that starts to occupy more space within the abdominal cavity. This tumor presses against the stomach, intestines, and other organs, leading to a constant feeling of pressure and discomfort. Also, ovarian cancer causes inflammation in the abdominal area, which further contributes to the pain. Even research from the British Journal of Cancer proves that inflammation caused by ovarian cancer causes pain by irritating the abdominal lining and nearby organs. Secondly, the cancer causes a condition known as ascites, which is the accumulation of fluid in the abdominal cavity. This fluid buildup leads to swelling and increased pressure, adding to the pain and discomfort. This makes you feel like your abdomen is constantly stretched to its limit. Number 2. Bloating. Do you feel bloated all the time, even when you have not eaten much? If yes, then do go for a checkup, as it is not a good sign. Chronic bloating, where your stomach feels full and tight, is a sign of ovarian cancer. This symptom is often mistaken for gastrointestinal issues, or even weight gain. However, if the bloating does not go away even after passing gas or having a bowel movement, and is persistent and often gets worse over time, then you should definitely not ignore it and consult your doctor. Ovarian cancer causes bloating due to different reasons. As mentioned earlier, when the tumor grows, it takes up space in the abdominal cavity, causing a feeling of fullness and tightness. This tumor presses against the stomach and intestines, disrupting normal digestion and leading to bloating. Apart from this, ovarian cancer causes changes in the way your intestines function. Even a study in gynecologic oncology confirms that intestinal obstruction by the tumor is a common cause of persistent bloating in ovarian cancer patients. It's because the growing tumor obstructs parts of the intestines, making it difficult for food and gas to pass through. This obstruction leads to a backup of digestive contents, causing bloating and discomfort. The inflammation caused by the cancer also irritates the lining of the abdomen and intestines, contributing to bloating. Inflammation is the body's response to the tumor, and while it's an attempt to fight off the cancer, it also causes additional discomfort and swelling. Number 3. Difficulty eating and feeling full. Another major sign of ovarian cancer is experiencing difficulty eating and feeling full quickly. Think of it like you sit down for a meal, ready to enjoy your favorite dish, but after just a few bites, you feel uncomfortably full. This sensation is perplexing and frustrating, especially if it is not something you have dealt with before. Ovarian cancer causes this early satiety for a few reasons. The cancer disrupts normal digestive processes. The tumor presses against the stomach or intestines, slowing down the movement of food and causing you to feel full more quickly. This disruption also leads to other digestive issues, such as nausea or indigestion, making it even harder to eat. This is not something assumed. In fact, proper research has proved that tumor growth in ovarian cancer patients significantly impacts digestive processes, leading to early satiety and related symptoms like nausea. That's why when you try to maintain your normal eating habits, each time you start a meal, you are forced to stop because you feel uncomfortably full. This makes it challenging to get the nutrients you need, leading to unintentional weight loss and weakness. The emotional toll of this symptom is also significant. It is frustrating and worrying not to be able to enjoy food the way you used to. You start to dread meal times, knowing that you will likely feel uncomfortable and unsatisfied. Number 4. Frequent urination. Are you running to the bathroom more often than usual? Increased frequency of urination can be due to many factors, but it is also a sign of ovarian cancer. If you find yourself needing to pee more frequently without drinking extra fluids, it might be because of pressure on your bladder from a growing ovarian mass. Ovarian cancer causes frequent urination mainly because of the tumor's growth within the abdominal cavity. The bladder and the surrounding organs are tightly packed in the abdominal cavity. When a tumor starts growing, it pushes into the space occupied by nearby organs, including the bladder. This pressure reduces the bladder's capacity to hold urine, making you feel like you need to go more often, even if your fluid intake has not increased. Also, the buildup of fluid in the abdomen, known as ascites, contributes to this symptom. As told earlier, the fluid adds extra pressure on the bladder. The combination of the physical presence of the tumor and the additional fluid creates a situation where the bladder is constantly under pressure, making it feel full even with a small amount of urine. Well, it is more than the need to urinate frequently. You also experience a sudden, urgent need to go, which is quite inconvenient and sometimes embarrassing. Interestingly, studies have shown that the pressure exerted by both the tumor and the ascites changes bladder function. Understanding these changes highlights why this symptom should not be overlooked and needs a checkup with your healthcare provider. Number 5. Menstrual irregularities. Menstrual irregularities are not always due to hormonal changes. Sometimes they indicate a serious health issue like ovarian cancer. So if you've noticed your periods becoming irregular, it could be more than just a temporary change in your cycle. Ovarian cancer causes significant disruptions in your menstrual cycle, leading to symptoms such as heavier bleeding, spotting between periods, or bleeding after menopause. The main reason behind these menstrual irregularities is the hormonal changes brought about by the cancer. The ovaries are responsible for producing hormones like estrogen and progesterone, which regulate your menstrual cycle. When ovarian cancer develops, it interferes with the normal functioning of the ovaries, leading to an imbalance in these hormone levels. This imbalance causes your periods to become unpredictable or abnormal. Also, research was made that the presence of a tumor in the ovaries affects the nearby reproductive organs. The tumor causes inflammation or irritation in the surrounding tissues, resulting in abnormal bleeding. Like a tumor puts pressure on the blood vessels and tissues in the pelvis, leading to spotting or irregular bleeding outside of your normal menstrual cycle. Number 6, fatigue. Do you feel tired all the time, no matter how much you rest? No, I am not talking about normal fatigue due to a hectic routine, but chronic fatigue that increases daily and interferes with your daily activities and overall quality of life. If yes, then it is not something to be overlooked. It is something as serious as a cancer. Yes, chronic fatigue is a common but overlooked symptom of ovarian cancer. This kind of fatigue is deep and continuous and makes everyday activities feel incredibly draining. You might find yourself struggling to get out of bed, feeling exhausted even after a full night's sleep, or needing frequent naps throughout the day. In fact, the Journal of Clinical Oncology's research vouch for this that ovarian cancer consumes all your energy and left you with fatigue and tiredness. The reason for this intense fatigue is multifaceted. Firstly, as the cancer cells grow and spread, they consume a lot of the body's energy resources. This leaves less energy available for normal bodily functions, resulting in a constant feeling of exhaustion. Apart from this, ovarian cancer causes anemia, a condition where there are not enough red blood cells to carry oxygen throughout the body. This happens because cancer disrupts red blood cell production or causes internal bleeding. This leads to a significant drop in hemoglobin levels. When your tissues and organs do not get enough oxygen, you feel fatigued and weak. Another major factor contributing to fatigue is the body's immune response to the cancer. The immune system releases substances called cytokines to help fight the tumor, but these also lead to feelings of tiredness and weakness. This is part of what's known as cancer-related fatigue, which is different from regular fatigue because it doesn't go away with rest. Number 7, back pain. Is back pain a constant part of your life? While back pain can result from various issues, continuous lower back pain is a symptom reported by many women with ovarian cancer. This pain usually feels different from typical back pain and doesn't improve with rest or standard treatments, The first reason behind this back pain is that as the tumor grows within the pelvic region, it exerts pressure on the lower back and pelvic area. This pressure causes a dull, aching pain that radiates through your back and sometimes is felt in your legs as well. This is not normal pain. The Journal of Pain and Symptom Management states that this pressure from the tumor highly contributes to the persistent back pain experienced by ovarian cancer patients. Also, fluid accumulation in the abdomen increases the pressure in the abdominal cavity, which then transfers to the lower back. The extra weight and pressure from the fluid strain the muscles and nerves in the back, leading to persistent pain. As you know, cancer can metastasize or spread to the bones, including the spine. When cancer cells attack the bones, they cause pain and discomfort. This type of pain is usually more intense than muscular pain and can be quite debilitating. Also, the tumor interferes with the normal functioning of nearby organs. For example, if the tumor is pressing on the intestines or urinary tract, it causes referred pain, which is pain felt in an area different from its source. This referred pain sometimes manifests in the lower back. Number 8. Constipation or diarrhea. Constipation or diarrhea are also unexpected signs of ovarian cancer. You may experience sudden changes in your bowel habits, swinging from constipation to frequent, loose stools. These disruptions are distressing and are usually linked to less serious conditions, but they also signal something more severe. Besides physical changes, which we have mentioned before, the tumor also causes chemical changes in the body. The cancer cells release substances that affect the nerves controlling the intestines, leading to either slowed movement or increased movement. These substances affect the digestive system balance, causing irregular bowel movements. A study in cancer research found that the substances released by ovarian cancer cells significantly alter gut motility, leading to these symptoms. Also, the body's immune response to the cancer involves releasing various chemicals to fight the tumor, but these chemicals also irritate the digestive tract, leading to increased bowel movements and discomfort. Number 9. Weight loss or gain. Weight loss and gain can be exciting for some, but losing or gaining too much weight without any extra effort is not a good sign. Excessive weight loss or gain is also a symptom of ovarian cancer, reflecting the complex ways the disease affects the body. Ovarian cancer can cause weight loss, mainly due to a decrease in appetite and difficulty eating. As the tumor grows, it makes you feel full quickly, even after eating small amounts of food. This leads to a significant reduction in calorie intake. Over time, this results in noticeable weight loss as your body isn't getting the nutrition it needs. According to the Journal of Clinical Oncology, the metabolic demands of cancer cells are high, which contributes to this unintentional weight loss. As you know, the cancer cells themselves consume a lot of energy as they grow and multiply. This increased metabolic demand leads to unintentional weight loss. On the other hand, weight gain can also occur. Due to the accumulation of fluid in the abdomen, it is caused by the leakage of fluid from the blood into the abdominal cavity, which the body can't drain away properly. This makes your abdomen appear swollen and increases your overall body weight, even though it's not related to fat gain. So before getting happy about these weight fluctuations, just think once about why it is happening to avoid later regrets. Number 10. Unexplained vaginal bleeding. Another symptom that you should not ignore is unexplained vaginal bleeding. This type of bleeding is alarming, especially if it occurs outside of your regular menstrual cycle or after menopause. Ovarian cancer causes unexplained vaginal bleeding due to the disruption it creates in the reproductive organs. The tumor itself causes physical changes in the uterus and surrounding tissues. If the cancer spreads from the ovaries to the lining of the uterus, it causes the endometrial tissue to become thickened and unstable. This instability can lead to unexpected shedding of the uterine lining, resulting in abnormal bleeding. Also, ovarian cancer spreads to other parts of the reproductive system, including the fallopian tubes and cervix. This spread causes further irritation and damage to these tissues, contributing to unexpected bleeding. The American Journal of Obstetrics and Gynecology made it clear that such metastasis usually leads to significant changes in reproductive tissues, which are manifested as irregular and unexplained bleeding. This causes further irritation and damage to these tissues, contributing to unexpected bleeding. Ovarian cancer is a serious condition, Many females just overlook these signs considering it as a normal illness, but early detection significantly improves outcomes. It's important to listen to your body and recognize when something is off. If you experience any of these symptoms frequently, don't ignore them. Consult your doctor and discuss your concerns. If you enjoy this video, give it a thumbs up and share it with your friends to raise more awareness about the symptoms of cancer. Also, subscribe to our channel to see more health guides.